Have you ever been jolted awake in the middle of the night with a sharp pain in your leg, so strong it feels like your muscle is being twisted? You're not alone. Millions of people suffer from leg cramps, and for years, we've been told it's just dehydration or not eating enough bananas. But what if I told you that modern medical research has revealed a completely different story, one that involves your nerves, your muscles, even your age, and sometimes the medicines you take? Stay with me, because by the end of this video, you'll understand the real science behind leg cramps, and I promise, it's not what you think. Hi everyone. Today, we're going to explore something that almost everyone has experienced at some point: leg cramps. Those sudden, painful muscle contractions, usually in the calf or foot, that seem to strike out of nowhere, especially at night or during exercise. While they often pass within minutes, they can be so intense that people want real answers about why they happen. And the truth is, modern medical research has uncovered much more than the old myths of simply not drinking enough water or lacking potassium. So, what's really happening inside the body when a cramp hits? Doctors describe a leg cramp as an involuntary, sustained contraction of a muscle caused by overactive signaling between the nerves and the muscle fibers. Instead of relaxing normally, the muscle locks into a tight, painful state. For decades, people believed this was mainly due to dehydration or electrolyte imbalance. But large reviews, including studies published in the Journal of Neurology and summaries by the Cleveland Clinic, show that this explanation is not sufficient in most cases. Dehydration and low electrolytes may make cramps worse, but they are not the primary trigger for the majority of people. The leading medical theory today focuses on neuromuscular hyperexcitability. That means the nerves controlling the muscles start firing too many signals, while the normal inhibitory mechanisms that tell a muscle to relax don't work as strongly as they should. Research in sports medicine has shown that fatigue can disrupt the balance between two key systems: muscle spindles, which stimulate contraction, and Golgi tendon organs, which promote relaxation. When the spindles are overactive and the tendons underactive, the result is a sustained contraction, a cramp. This explains why athletes or people who suddenly increase activity are more likely to experience cramps, especially during or after exercise. Age is another important factor. As people get older, they naturally lose motor neurons, the nerve cells that connect to muscles. Studies published in the journal Age and Aging show that this denervation makes muscles more unstable and prone to misfiring. That's one reason why nocturnal leg cramps, cramps that strike at night, are especially common in older adults. The way we sleep also contributes. Lying with the feet pointed down keeps the calf muscles shortened, and this shortened position is more likely to trigger abnormal nerve firing that causes cramps. Medical conditions can also increase the likelihood of cramping. People with diabetes, peripheral artery disease, kidney disease, liver problems, thyroid disorders, or neurological damage such as neuropathy are all at greater risk. Research has also documented that certain medications are linked to cramps. These include diuretics, which change fluid and mineral balance in the body, statins, which affect muscle metabolism, and some blood pressure and hormone therapies. Even medications like gabapentin, designed for nerve pain, have been reported to cause cramps in some patients. When someone suddenly develops frequent cramps after starting a new medication, doctors will often review whether that drug is the cause. So, where do electrolytes and hydration really fit in? It's true that extremely low levels of potassium, magnesium, or calcium can lead to cramping, especially in people with medical conditions that cause mineral loss. For example, Dialysis patients or those on high doses of diuretics may develop cramps from these imbalances. But in the average healthy person, research published in Scientific American and summarized by the National Institute of Health suggests that fluid loss or mild electrolyte shifts from sweating are not enough to explain most cramps. In fact, controlled trials have shown that athletes who are well hydrated still get cramps when their muscles are fatigued, further supporting the neuromuscular theory. The body of evidence points strongly to a combination of factors: the excitability of the nervous system, the fatigue of the muscle, the structural changes that come with age, and the presence of underlying disease or medication side effects. That's why doctors often say that leg cramps are multifactorial. There isn't just one cause, but rather a set of overlapping reasons that make some people more prone than others. To summarize, when we think of leg cramps today, we shouldn't just blame not drinking enough water or missing a banana in our diet. Instead, the medical explanation is much more about how nerves and muscles interact, how fatigue and aging change that relationship, and how certain illnesses or drugs can push the system out of balance. Understanding this helps us move away from myths and closer to real solutions. In the next video, we'll explore what you can actually do the moment a cramp strikes, looking at quick, research-backed ways to stop the pain. And after that, we'll dive into long-term prevention strategies. If you've ever suffered from leg cramps or want to share what triggers yours, let me know in the comments. Thanks for watching, and I'll see you in the next one.